muscles, yeah. And now we are start Splanchnology. It's a big part of the human anatomy, and now it's a visceral systems, digestive, respiratory, urine, and genital. Some student, only 3 persons with your group, sent to me a presentation about 12 systems, and thank you, Musa. I'm download your picture about very interesting cake in in the systems in our Instagram, and students many likes. This is picture. Maybe some other student may drawing or painting some. It's not only 12 system, dear student. It may present different picture about human anatomy. Really, send to Telegram or send to our Instagram, and we will download and with your name if you want. It's very interesting. Maybe some student record some video in human anatomy. It's very good too. So and I maybe opened only one. Jana Said, yes, present today. Jana.
Yes.
Yes, thank you for you new. I looked in a time when you sent to me this presentation and understand. I may opened and only some remark about your presentation. It's a very interesting position here. Yes, 12 months, but maybe some student ask Jana, what systems in this picture absent? Find place in the picture. What system absent?
Articular system.
Brain. Brain, right? Hello?
Not only articular system. Find place.
Elementary system. Elementary.
Elementary.
Digestive.
It's a same with digestive here. Yes. Male and female reproductive, more correct, used name genital. And genital, it's a one system with 2 parts, male and female, yes? And enough genital together in a one variant, for example. And next, it's joints in a other variant, yes? Maybe, Jana, you can change this is slide in the future and send with numbering in a first picture. It's a joint.
Yeah, okay.
Next, first bones, second joints, muscle, alimentary, respiratory, urinary, genital, endocrine, cardiovascular, lymphoid, nervous, and sense organ. And if you, it's not very big mistake. You very good make presentation, but skeletal. Next, change muscle, or in this is line skeletal muscles. And connect picture with joint. Yes. Next big portion of the Splanchnology will be in this portion. It's a digestive, respiratory, urinary, and if you remember, genital together, yes, and endocrine glands. Next time will be three parts of the three systems of three system of the integral first. It's endocrine, cardiovascular, and lymphoid. Yes. And in a Finnish, sense organs, nervous system, integument, commune. Integument represent here, but absent fourth system plus. It's sense organs. Yeah, sense organs here to absent. It's you if you change more will some structure. One moment. Okay, skeletal, great. Big portion text not used, please, in the future in the presentation. Only picture and not choose with this correct size. It's more correct here, yeah. Integument, commune, function, yes, lymphatic system. Lymphatic system, very interesting moment. Now in a modern terminology used, sorry, one moment. So, used lymphoid organs. Yes, I'm look all presentation, and I'm in the next time will revised some presentation. And you remember I have a book for better presentation, and today it's a really I think about Musa because make presentation a very interesting presentation and drawing of picture, and I think maybe some student make presentation will make or will drawing picture. It's today really it's a favorite Musa, but maybe some student think maybe I too make presentation and draw picture, and human anatomy book will be yourself. I hope this week near New Year will very interesting for you. So great, but big portion, yes, big portion, different text, really interesting information, Jana. But if you change your presentation to 15 slides, first in this slide, finish slide, thank you. Yes, third slide, it's a 12 system together, and only one slide to one system. Very short information about this structure. Okay, Jana?
Okay.
But it's a great job. Thank you very much. I hope you don't stop in the future. We'll continue in this moment too. In the chat, for me, some student were revised my presentation. All presentation looked. I writing to you answer, and I'm ready when really all student with the group, maybe all present student send some version with your Vision 12 system, and in the next week it will be last lecture, and we ask who winner in this is in your group in this is concourse. So today we have Splanchnology lecture. Splanchnology, it's a big parts. All organs after skin, really it's internal organs. Internal organs, but Splanchnology, it's only digestive or alimentary system, respiratory system, genital and urinary system. A long time was in Splanchnology endocrine system, yes, but now endocrine system, cardiovascular and lymphoid system, it's integral systems first. And only four main visceral systems, it's alimentary or digestive, respiratory, urinary and genital system, really include Splanchnology or visceral systems, visceral organs. Digestive tract, very long. Digestive tract, digestive system, alimentary canal. It's a different name, but if told about only digestive tract, it's without liver, without pancreas, because it's the biggest glands in our body, and tract it's a same with the tube system. It's a when present organs too. Next one, respiratory system. Respiratory system, upper and lower respiratory ways, nasal cavity, pharynx, larynx, trachea, bronchus, and lungs. Lungs with bronchus located in thoracic cages and in the chest, and exchange oxygen in the respiratory system. Genital system, it's very interesting. Different methods for studying of the human anatomy good. It's, for example, genital organs in a female. Next one, you looked in a digestive tract and were located all internal organs. Present some classification internal organs. It's a parenchymal with parenchyma. Parenchyma, it's a this big part of the stroma, and tubal form, and some organs have cavity. For example, stomach, it's a will be with big sac for food, and big portion of the pleatza. Pleatza, it's a where mucous membrane have different form, and not only internal structure, serous membrane in external structure have some special structure in external. Parenchymal organ, it's a liver, for example, and kidney. Liver and lungs and other liver, kidney, lungs have lobes, segments. It's very important for understand vascularization and innervation. This is organs. Some organ are not only parenchyma, for example, tongue. Tongue in the oral cavity have big portion of the muscles, and in the mucous membrane some structure for taste and different taste. The oral cavity present tooth and it's special organs with a special form. Maybe you know how many teeth in adult. You can type in the chat now. I'm waiting. How many teeth in the chat? No. What is it? 16, 14, 32 in adult. Yes, great. How many milk teeth in a child? 20. Great. When starting moving first tooth in a child? In the chat, please. 7, 8 age. It's no. In a child, first teeth first moving in the oral cavity when it's time to 1 years. Together, really, it's a 20 teeth, but first tooth 6. What 6, Musa? It's a
So he loses when he starts losing when he's 6 years old?
It's a 6 months. 6 months.
Oh.
6, 7 months. It's the first tooth in the oral cavity in a child.
I thought, when do you start losing them? Like the first teeth?
Okay, yes, first teeth. And when all 20 teeth present in the oral cavity in a child, what ages? No, not 10 years. When? No, not 8 years, not 3, not 20. Other variant. No.
Professor, sorry, what's your question again?
When, what time, what ages in a child will be 20 teeth? It's 24 months or 2 years. Very simple for remembering. 6 months, first teeth in child, newborn child, 6 months, first tooth. Next time, 24 months will be all 20 teeth in the oral cavity, or 2 years old. 6 year, it's a when change milk teeth to teeth in adult. Okay?
Yep.
Thank you. And very important, it's a layers in the structure of different organs in the digestive tract and respiratory tract and other. For example, it's esophagus, and in esophagus will be mucous membrane, tunica mucosa, tela submucosa with big portion of the vessels, nerves, and other structure, and tunica muscularis with different muscle layer. In a tubal form organ, for example, duodenum, esophagus, ileum, it will be only 2 layers, circular and longitudinal layers. And in the other, for example, in the stomach, between these 2 layers may present oblique layer too. And very important, its structure, serous membrane. 3 serous membrane present in internal organs. It's a pleura with visceral and parietal layer. In abdominal cavity, same serous membrane with pleura. It's a peritoneum with visceral and parietal layer, and between 2 lungs present heart located in a special sac with name, maybe you know, with in a book later P. This is structure. Type to chat or told with microphone.
Lungs.
No, between 2 lungs present heart. Heart located in a special sac with serous membrane. Yoni, what your opinion? It's a pericardium.
Pericardium. Right?
Pericardium, okay, it's a cardiovascular system, but after this lecture, you remember 3 serous membrane in the human body. It's a pericardium, pleura, and peritoneum with 2 layers, visceral and parietal. Okay, great. Yoni, maybe you, if you can, switch on your video, because I understand you looked and understand some information, or maybe some other student may switch on microphone and video. Oh, thank you so much. Great, Musa, and you too, present. You today in the big mic earphones, yes, Musa.
Yes, Professor.
Because in your room present some other student.
No, otherwise I wouldn't be able to hear you properly.
Okay, I'm too with earphones because it's only connect with auditory. It's same when really present in auditory and okay. Thank you. Next time here, if you looked here, some structure of the liver. Yes, it's a segment. We looked in a structure. It's a parts of the liver, right and left. And next, liver have lobes. Lobes include some segment. 8 segment in a liver. Remember, please. 5 segment in a kidney. And 10 segment in a right lung, and 10 segment in a left lung. Segments is very important because it's one moment, sorry, one few minutes. I'm so sorry. And lungs, right and left, 10 segment. If we looked in lobes, in right, 3 lobes, 1, 2, 3, and 2 lobes in left. lung, but I replay right and left only with 5 segment. It's a kidney. Kidney have 5 segment. And 10 segment in the lungs. Endocrine glands, where I replay information. Endocrine glands, it's a structure of integral system first, with cardiovascular and lymphoid system. For all internal organs, very important topography. Topography of internal organs, it's a skeletotopy, syntopy, and a holotopy. Skeletotopy, it's well located different organs near skeleton, near ribs, for example. Syntopy, which organs connect with this is organ, for example, liver connect with diaphragm, with bile duct, with stomach, duodenum, and other. And here, for example, stomach can connect with ribs in a near fundus, and skeleton vertebral column tense thoracic body of tense thoracic vertebrae. It's a place where starting opening of stomach, or gaster or ventriculus. 3 names for stomach. Stomach, ventriculus, it's a Greek language, and gaster in the Latin language. With Latin language, it's disorders, yes. Gastritis, it's inflammation of mucous membrane of the stomach. And in the Finnish, lumbal first vertebrae body, it's Finnish pyloric sphincter of the stomach. Skeletotopy, very important too for auscultation of lungs, for example. Different point of the between ribs, it's a different point for auscultation different parts of the lungs. Liver, for example, location skeletotopy, liver, it's syntopy, which different organs touch with liver, for example, with stomach, it's a syntopy. And holotopy, it's when you remember in your workbook present some pages where different region have some number name, and in the abdominal cavity present 9 regions, and maybe you now typing in the chat what number 1 region in this is variant. Okay, as a different question. Number second, what is region here?
Epigastric fossa.
Epigastric fossa, yes, epigastrium, more correct. Fossa, it's a when really present some cavity, but it's a cavity absent epigastric regions. Epigastric region it's a region where located a big portion of the stomach. But two lines, horizontal, 1 and 2, yes? This is point, it's a finish if you can touch your ribs with two fingers, yes? Two fingers, you touch your here ribs and moving to ending point in a down. It's a 1 point and next point in a right and left. This is line relate epigastrum with and mesogastrium. 4, 5, 6, it's a mesogastrium, and 2 points to this is horizontal line. It's a spina iliaca anterior superior. Do you understand where location this is structure? Spina iliaca anterior superior, it's a structure of iliac bone, and two bones to this is point. It's a delayed mesogastrium and hypogastrium. And 3 floor, yeah, it's a will be epigastrium, mesogastrium, and hypogastrium. And epigastrium first and third hypochondrium region, second right and left, yes, second or number 2 it's a epigastrium, epigastric region. 4, 5 it's a umbilicus, umbilic here, yes, structure, umbilic region. And 8, what is structure? Pubic region, epigastric, umbilic and pubic region. Next one, number 4 and number 6. It's a lateral right and left region. And number 7 and number 9, it's a inguinal right and inguinal left region. This is structure very important in the future when you will be in a surgery in a topographic clinical anatomy. It's very important in the future for understand where located some organs. Big mistake when in this region ask about told about lumbal region. It's a not lumbal region. Lumbal region will be in the back, in the spine. Here it's not correct. It's a lateral region. And if you will look in a different atlas and in a region, look first time writing what correct number here, names here. And if it's a iliac region left, it's a right. What name is correct this region?
Hypogastric.
Iliac region.
No, it's not correct. Iliac
Hypogastrium.
together it's a hypogastrum. It's a not iliac. It's a inguinal region. Inguinalis, inguinal region here, 7 and 9, and inguinal right, inguinal left, and here not hypogastric. In a hypogastric, this is pubic region. Pubic because pubis bone here located. Okay. So, for example, it's a big portion internal organs in projection of the anterior wall of the abdomen. What is organ? Maybe no.
Duodenum.
Duodenum.
No.
Yes,
Gallbladder,
duodenum.
gallbladder.
Duodenum. And
Yeah.
here, what is gland?
No.
What is glands in a digestive system? With a special juice in a duodenum.
Gastric.
It's a pancreas.
Gallbladder.
No, it's a pancreas. Pancreas.
Oh, pancreas.
Pancreas. It's special organ located in this region.